Well, my grandfather was a union carpenter, and it's just something that's kind of been in the family. Dad's always been a do-it-yourselfer. Man, I started working on bicycles when I was probably 12, and just got into it. Just always enjoyed tinkering with stuff, making it work, fixing it. Been studying sustainable construction for the past 4 or 5 years. It's interesting because it takes a look at the built environment and how to have less of an impact. Learning to be sustainable is an important part of living. I went to job training sponsored by the EPA, was environmental brownfield remediation. Go in and clean up dirty sites. Get HAZWOPER training, get lead certification, asbestos training. I mean, we walked away from that course with probably 12 to 15 different certifications and state licenses. I was working part-time and going to school trying to complete my degree. It was just changing oil. Changing oil part-time when they'd give me the hours. I was picking up a big old tire and my back hurt. Wasn't even going to report it. Turns out I've got a ruptured disc in my lower back. I mean, I'm on work restrictions. Can't lift over 30 pounds, can't bend repetitively. So I'm trying to look at different ways for me to be effective in my career with the experiences that I've had. When you can't afford to go to the doctor and you're sick, you just stay sick. I need some type of treatment. I can't afford that out of pocket. I can't pay for that. My own health care would allow me to seek the treatment that I need with an objective opinion. Not a workman's comp doctor, not somebody working for an insurance company, a doctor who's looking out for my health and welfare. Every time I've turned to social services, I've had the door closed in my face. Every time. I'm stuck to borrowing from family and friends. It's a vicious, vicious cycle. I would love to afford health insurance again, to afford putting groceries in my fridge that I'm not borrowing money from the state, pay for my rent without borrowing from mom and dad, to be a positive part of the community, to be contributing, putting money into the tax base. Would like to be able to stand on my own 2 feet. I'm a grown-ass man, I should be able to do that. But I haven't been, and that's pretty disappointing. My earnings are too low in order to qualify for federal tax credits or cost-sharing reductions. There's about 300,000 people that are left in this gap that are making between nothing and the federal poverty level. They don't qualify for any federal assistance or state assistance with health care. The poorest people in the state declined affordable care. That's specific to Missouri and any other state that did not get involved with the federal marketplace. If people are sitting at home sick, they're not making money. They're not contributing to the economics of the state. My understanding is that if they expanded Medicaid to include the people that fall below the federal poverty level, it would mean that the state is investing in the people by giving the people the opportunity to help themselves.